ERN-NMD is the European Reference Network for Rare Neuromuscular Diseases. Can you go to the next slide, please? Thank you. There is an animation, I think. So just to give you a little bit of background, EURO-NMD is quite a big ERN. We have currently 84 HCPs and a total of 37 patient representatives coming from 27 patient organizations in 13 countries. So this slide is just to give you a bit of information regarding the structure of patient participation in EURO-NMD. So as I said, 37 patient representatives at the moment, of which 10 maximum are composing the patient advisory board. It's a system where there are 2 levels of engagement for patients, 1 patient advisory board composed of 10 member maximum, who is part of the governance structure of the ERN, which means that the 10 PAB members are full board members. They're invited to the board meetings. The chair of the patient advisory board is also a part of the executive committee, as well as actually 2 other PAB members who are also the chair of the education board, the chair of the ethics committee, and then we have co-chairs for some of the other working groups, such as the muscle group. In the image, you can see that we actually have 13 working groups. So 5 specialist disease groups where you have between, I would say, some have 1 patient representative, some have 10. You also have cross-cutting specialist groups, education board, research, and ethics committee. And so when we were talking about the 37 patient representatives earlier, among the 10 PAB members, you have also members of different working groups, and the 27 who are not members of the PAB are each at least member of one of the other 13 working groups. Can you go to the next slide, please? So on the left side, you will see the members of the current members of the patient advisory board, so limited to 10 members. And this structure with 2 levels of engagement has allowed PAB members to express their views on different topics during executive committee meetings, because as I said, we currently have 3 PAB members who are members of each of the executive committee meetings which take place, every month. So they are consulted during discussions regarding the strategy of the ERN, and usually following each of the executive committee meetings, we have a monthly PAB meeting where we report on what has been discussed during the exec and take in all of the comments to be able to provide them during the next executive committee meeting. And there has been a very close collaboration with the coordination team to suggest and develop patient-led activities. And actually, I think, as Garam said, the attitude and philosophy of the coordination is very important to allow a bigger patient involvement in the ERN. And this is really a strong point in EURO-NMD, with the coordination willing to do as much as they can for patients to be more involved. And there I just added some information regarding the patient engagement manager role, which is actually my role. I've been working to support the patient advisory board for the last couple of years. I'm not an ePAG myself, but I work in an ePAG organization. And I have been liaising with patient representatives, with PAB members, and with the coordination team to see how we can continue to enhance patient participation in the future. Can you go to the next slide, please? And so a couple of examples of patient-led activities. A couple of years ago in 2019, patients were very interested in doing a project on newborn screening and decided to launch a qualitative study on newborn screening. It was conducted by the PAB, and it was presented during a genetic board meeting and then an annual meeting, because it was of interest to the whole ERN, and it actually led to a joint publication between the PAB, the coordinator of the ERN, and the chair of the genetics group. and then subsequent work on the topic. We also had a webinar on quality of life for neuromuscular diseases that was organized last year. It was a topic discussed among patient representatives as a topic of interest to focus on for the year. And we worked all together to actually produce this webinar, and it was disseminated through EURO-NMD as one of their official webinars. There has also been work on also been work on educational videos on peripheral neuropathies, and this year we will focus on developing a set of patient journeys for neuromuscular diseases. So it's a project that is led by the Patient Advisory Board, and where we have at the moment, three diseases for 3 patient journeys to start with, and it's supported by the coordination, and the clinicians who will be involved in the project are clinicians from the different working groups. And we already have, we've just launched this project and already have interest for actually 2 to 3 additional patient journeys in next year, within the next semester or next year. And if you can go to the next slide, please. Thank you. So I just also put, of course, there is already cooperation and involvement of patient representatives within the network and the governance structure of the ERN, which is good, but there are still things that need to be improved in the future. One area of improvement that we've seen is how to enhance to have better communication, with patient representatives who are not members of the PAB, because as I said, the Patient Advisory Board meets monthly, but other patient representatives, we have a patient meeting twice a year online, usually, because they're not only PAB members now at the moment are invited to the board meetings, to the annual ERN meeting. And this is something we want to change. We want to be involved to be able to invite all 37 patient representatives. So improve communication towards other patients who are not members of the PAB. See with the coordination how to make sure that invitation and reimbursement is possible for all patient representatives within the networks, at least for the annual meeting, with at the very least possibility to join meetings remotely. And finally, more involvement of the Patient Advisory Board in budget planning, which we're starting to have to some extent now with the new grant, because the PAB will be involved in writing parts of the new grant together with the coordination team, but budget for every year is a different thing. And that's it for me. Thank you very much.